Hello, my name is Cy Nadler, and I'm pleased to present to you this video abstract for our forthcoming publication, Pharmacogenetic Testing in Patients with Autism Spectrum Disorder Evaluated in a Precision Medicine Clinic. I'm pinch hitting for our lead author, Rachel Goodson, and we want to thank all of our interprofessional team. We have nothing to disclose. So compared to neurotypical peers, patients on the autism spectrum are more likely to be prescribed psychotropic medications, and there's a lot of reasons for that, including higher rates of co-occurring conditions, but this leads to higher rates of polypharmacy, and we actually see lower rates of benefit from medication use, as well as higher rates of adverse reactions. There are a number of ways to consider trying to mitigate that, and one falls under this umbrella of pharmacogenetics, sometimes discussed under the auspices of personalized or precision medicine. Pharmacogenetic testing is the analysis of genes that are involved in drug metabolism and response. So the goal is to be able to tailor medication use to reduce adverse reaction likelihood, as well as improve drug efficacy. We have limited data on precision medicine and pharmacogenetic testing for patients with autism, but we feel there's an opportunity, and this is recognized in the literature too, that for patient populations with high rates of ADRs as well as poor response, possible tailoring based on their genotype is an opportunity for improvement. We're particularly interested in CYP2D6 and CYP2C19 enzymes because they are known to be relevant for medications commonly used for patients on the spectrum. So our study was to describe the course of patients referred to a precision medicine clinic, as well as just explore some of the relationships between patient variables as well as their outcomes. We conducted a retrospective review of about 10 years worth of patient data, and I'll note that we are drawing from the Goldilocks Clinic at Children's Mercy, Kansas City, which is not an autism-specific precision medicine clinic, but serves our entire pediatric patient population. So we found about 200 patients on the spectrum who have been seen in this clinic over the course of our study. They are majority male. We saw less diversity in this patient population than expected, given the other places where we serve patients on the spectrum in our hospital. Patients were primarily referred because of adverse drug reactions or poor medication response, as we would expect. You can see that the patient population we identified universally had at least one co-occurring mental health condition, and you can see that they were prescribed medications from a number of drug categories. In terms of metabolism status, we saw relatively lower rates of rapid or ultra-rapid CYP2C19 metabolism status compared to population controls. We also saw higher rates of poor metabolism for CYP2D6 compared to population samples. We're interested in if we can predict adverse drug reaction risk, and we did see an association between age and higher rates of non-psychiatric ADRs. We also saw that as diagnosis count, so the number of co-occurring conditions, increased for patients, they had higher rates of both psychiatric and non-psychiatric ADRs. In terms of predicting metabolizer status, we saw that, again, diagnosis count, to the number of co-occurring conditions a patient presented with, increased the odds that they would show poor CYP2D6 metabolism status. We also saw that non-psychiatric ADRs were predictive of having lower risk for being a CYP2C19 rapid or ultra-rapid metabolizer. So take-home points, we are seeing some evidence for differential CYP2D6 and CYP2C19 functional phenotype distribution. We need more data to confirm if this is a robust finding, and as well as to verify and explore further the associations between clinical presentation as well as metabolism status and drug response. So as we seek larger data sets that are better characterized and more representative of the entire population, we're hopeful that we will better understand not only the potential for pharmacogenetic testing, but also when and for whom it's going to be most effective. And finally, we're hopeful that we can see greater diversity and greater representation within these samples, both to inform the algorithms and ensure a benefit for everyone, as well as ensure equitable access to care. So we thank you for your interest in our study and invite you to reach out to us with your questions.